Welcome back to AM Northwest. October is Breast Cancer Awareness Month, and we want to highlight the efforts of a local organization educating, empowering, and supporting those affected by breast cancer. Here to share more, we welcome from Pink Lemonade Project CEO Susan Stearns, along with breast cancer survivor and volunteer Monica Gonzales. Thank you both for being here. First, let me find out from you, Susan, to explain to our viewers what Pink Lemonade is, what you do.
Sure. Thank you so much for having us.
Yeah.
Pink Lemonade Project is a community-based nonprofit that serves all of Oregon and Southwest Washington. We provide the full continuum of care, so education, outreach, awareness, early detection, and then after a breast cancer diagnosis, we have full education, emotional support, psychological support, and financial support for patients along the journey.
Wow, that's incredible. And Monica, you're a volunteer.
Yes.
Let's talk first though about how many people are affected by breast cancer. I understand it's 1 in 7 now. 1 in 7, is that right?
Let me answer that.
You bet, you bet.
So the national average risk of breast cancer is 1 in 8, and in the Pacific Northwest, the rates are 1 in 7. So
Okay,
there's a
that's
higher rate of breast cancer in the
Wow.
Northwest.
Yeah.
Yes.
Monica, tell me about when you were diagnosed and what stage and your
It's
journey a bit.
In October 2021, and I was in a stage 3.
Wow.
It was triple negative.
Wow. That must have been so unbelievable for you to go through this. What was that experience like?
Oh, wow.
Tough on
My
you, tough on the whole family?
experience, Yes.
Yeah.
With my family, all the people around me.
Yeah,
Yes.
it was a lot. And yet you decide to volunteer with Pink Lemonade. Why?
Because they have a lot of good stuff. Like, for example, they have a retreats, they have a group of support,
Group support.
group
Yeah.
supports, and they have a lot of things for my community, not only for me, it's for Latino community too.
I understand too that the rates are a little bit higher for women of color. Breast cancer rates are a little bit higher.
Yes.
So when you work with Latino women, you're able to kind of give them your experience so they can have someone to relate to, right?
Yes. Yes.
And talk to me about that, working with them, because what is your goal?
My goal is improve the women's and let us know they're not alone.
Right.
Yes.
That's
and
so
talk
important.
about it, because when you talk, you cure by yourself inside of you.
Right. And are there special issues that Latino women deal with when it comes to breast cancer? Is it fear of treatment? Is it fear of going to get diagnosed?
The most hard part is the fear when
Yeah.
they give you a diagnosis and they don't know what to do, where
Right.
you go, who's going to answer your questions, because sometimes the language is
There's a language difficulty
limited.
barrier. Sure.
So yeah, that's the big issue.
Right. Okay. And Susan, go
Well,
ahead.
what I would add, Helen, is that we know that people who have added barriers to care, so language barriers, travel barriers, information barriers, really just are afraid to go into the healthcare system and get information. We're really trying, especially with more communities of color or colors that or communities that have added barriers to breast cancer care or information, is to let them know when recommended screening ages start. Those ages have changed in the last year and a half, so now we want to get the word out that people should be starting to get screening mammograms at age 40 these days.
Yes.
And not everybody knows that, or that information isn't equally spread across all communities.
Absolutely.
So I think Monica's remarkable in that she's got the lived experience, but she's just so passionate about getting breast health information and breast cancer support information back to her community.
Yeah.
And she does it in a beautiful way.
Oh, that's wonderful. That's so wonderful. You also do, Pink Lemonade also does retreats that are very helpful. I know I took the very first retreat 15 years ago.
Yes.
And it was incredible. Tell me about those retreats.
Sure, that was our foundational program when the organization started in 2010. Retreats are either 3-day experiences, or now we have a 1-day version. And it really is a time for people to process life after their cancer treatment and really redefine and look at life going forward again.
Yeah.
Our 1-day retreats in particular, we have one in Spanish for our Latinas.
Perfect.
And we also have one tailored towards the metastatic breast cancer community. So those living with stage 4 disease or ultimately have a terminal diagnosis
It
of
gives
their
you a
breast cancer.
community. Those retreats give you a community that you stay in touch with these people long after the retreat is over.
Absolutely.
You have an event also coming up, a girlfriend's walk.
We have many events coming
Oh, okay.
So, huge event, fundraiser for us this Sunday on the Vancouver Waterfront. Yes, it's the Girlfriends Run Walk. It's a sanctioned race, but also there's the non-competitive, just stroll along for a 6K, 10K, or a full or a half marathon. And come join us on the waterfront. You can register and donate to Pink Lemonade Project, or just come hang out with us at the booth. It really is a community awareness event for breast health and breast cancer, and we invite anyone to come and join us.
I know, and big shout out to Dr. Gabriel, who was my reconstructive plastic surgeon, and his wife, who started this 15 years ago.
Our founders are Alan and Cassie Gabriel, a husband-wife medical team in Vancouver, and they'll likely be with us at the walk on Saturday. Really visionary, and most of all, they wanted to provide more emotional and psychological support for their patients following the medical treatment. We really pick up where the healthcare system leaves off.
Absolutely.
And build that community of support.
You're doing great work. We want to tell everyone, if you'd like to find out about all the October events, all you have to do is go to our website at k2.com. It includes information too about the 10th annual Girlfriends Walk and Run. And Monica, great job. Thank you for what you do. I appreciate
Thank you for inviting
it.
us.
Thank you so much.
Thank you. All right, we'll be right back with more AM Northwest. Don't go away.